Joylux Happy Hour. Happy Wednesday. We're thrilled to have Dr. Kumar with us tonight, who's a board-certified urologist in New York. She graduated from Tufts University with honors and completed her residency at NYU. And I think today urology is still thought of traditionally as with male issues, but that's obviously not the case. And we get a lot of questions about urologic health issues. And so we reached out to Dr. Kumar to see if she could help us navigate some of those. All of these questions is actually what led Dr. Kumar to found her Women's Urology of New York clinic. And her goal there was really just to redefine the urology experience for women, knowing how much help we all need in this department. When Dr. Kumar became a resident at NYU, she really started to see the unique problems that women are faced with, from UTIs to pelvic floor weakness, incontinence, all the things that we continue to deal with as we age and go through childbirth and menopause. So we're thrilled to have you here with us tonight, Dr. Kumar. We're going to answer everyone's questions. So everything that's been submitted in advance, we'll try and get through all of those. If you have additional questions, feel free to pop those in the chat box and we'll try and get to all of those as well. So first of all, cheers to all of the amazing women on the call. We do these happy hours to provide education and a little fun on a monthly basis. So cheers to everyone and here's to our health. And Dr. Kumar, we're just thrilled to have you. Thanks for joining us.
Thank you so much. I'm really grateful to be able to speak to women about these issues, that actually affect all of us and that, often we don't talk enough about. And so I'm really happy to have a forum for folks to ask questions. I want this to be everything you wanted to know, but we're afraid to ask. And to educate women about pelvic floor health and most importantly, the types of options and solutions that are out there. Because I feel like part of the reason that we don't talk about these things is that we sort of accept them and we think that there's not really much you can do when there's a whole field of medicine actually dedicated to these issues, and there are a lot of different options.
Agreed. So you're leading us perfectly right into these questions here, but so many women wrote us and said as they have reached menopause, they notice a lot of changes in their urologic health, and specifically, they feel the need to pee every hour or two. So lots of folks are wondering if changing hormones plays a part in bladder function. Is there something related to menopause? And why is this happening? Why do we have to pee all the time?
Yeah, so this is a great question. This is what happens when you remember being able to hold it all day, and if you were at a restaurant and you knew you were going home, you could just wait, and that becomes no longer the case. And that can, it happens. So the frequent urge to urinate, we refer to that as overactive bladder. And it happens for a few reasons. One is aging, because the bladder is very neurologically controlled. And so the inhibition that we normally have over our bladder can weaken just simply with age. Hormonally, the bladder, urethra, pelvic floor are actually all estrogen sensitive. And so as our estrogen levels decline, our bladders actually become more sensitive and fire signals that we need to urinate at lower volumes and with more intensity. So that contributes to our symptoms of urinary urgency. And then we also become more prone to get older with menopause and with the lack of estrogen. And we actually have a name for this whole constellation of symptoms, which includes urinary urgency, frequency, vaginal dryness. You leak more easily, you get UTIs more easily, and we call it the genitourinary syndrome of menopause because the whole sort of constellation of symptoms happens to so many women as a result of the lack of vaginal estrogen and estrogen that is affecting the bladder and pelvic floor and urethra. So it is very related to menopause and very common. Over 40% of women over the age of 40 have overactive bladder symptoms. So it's an extremely common phenomenon.
Yikes, that explains it. And I guess then not just with menopause, but we've had lots of questions of new moms and young moms. And this gal says, I'm 36 and a mom of 2 little ones. After my second, I've become more likely to leak urine when I run, cough, sneeze, laugh too hard. So the question in general is, what can I do to get some control back?
So this is a great question, and I feel very empathetic towards new moms. As a mother myself, and kind of in that demographic, it is so important to maintain a healthy and strong pelvic floor both during and after pregnancy. When you're pregnant or you have a vaginal delivery, the structures that normally support your urethra and prevent you from leaking when you run or cough really hard, normally your pelvic floor is sort of it's holding everything in place. And when you start to lose that support, whether it's from laxity in the pelvic floor, from pregnancy, or whether it's from the tissue stretching a lot during like a vaginal delivery, you lose that support. And when you run or when you cough, your urethra and bladder neck actually jiggles. And when it jiggles, it can't stay shut. And that's how you get urine, which leaks out. And, women often go, oh, I just peed, or like they laugh really hard and they go, oh, I just peed. Or, they notice if they go jogging that their underwear is wet. And that's actually also such a common problem that happens to about 1/3 of postpartum women. And so this is definitely an issue that, urologists see and treat all the time, which we refer to as stress incontinence. So the first thing that you want to do is go see a pelvic floor physical therapist. So many women get told, oh, go home and do your Kegel exercises. Most women do not do Kegel exercises effectively. And that's for so many reasons. That's because, we don't know what muscles we're supposed to be using. We don't know how often we're supposed to be doing those exercises. So many women are squeezing their like inner thighs, their gluteal muscles, their abdominal muscles. And some women even have scar tissue around those muscles that prevents them from being able to contract the muscles effectively. So it's really important for pelvic floor physical therapy. I really emphasize doing it with a pelvic floor physical therapist for about 6 weeks. I usually tell my patients once a week for 6 weeks. And then, there are so many devices now on the market for pelvic floor rehab, which you can use at home. But I really think that seeing that therapist to begin with, to make sure you're actually gaining the strength in the correct muscles, is super important. So that's really like the first line. And I'm sorry, this is going to be a long answer.
It's great.
So that's really the first line. Okay. Then you have some women who come back and say, I did it and it was good while I was doing it. I felt it made a difference. And the problem is certainly better than it was. But, I still go to the gym and, I'm still leaking and I'm still having to wear a panty liner and I'm still having to think about it. And the main thing is, for so many of us, it's just a problem that we don't want to have to think about. So once you've done pelvic floor physical therapy, you start moving on to procedures. And so for procedures, we basically offer 2 types of options. One is what we call a bulking agent injection, and that's an office procedure where we inject a filler into the urethra. And what we use now is amazing, actually. It's like a water-based gel, and we inject it right under the urethral mucosal lining so that it essentially plumps up the tissue and tightens that bladder outlet so that you can't leak as easily. And that's been really effective in women, and a really nice sort of simple solution that you can have done, in the office, and it works immediately, and there's no There's no recovery or downtime. The other type of procedure that we do for this problem is called a sling. And a sling is where we place a material, whether it's a strip, like imagine like a ribbon of mesh, or we can use a ribbon of your own tissue. We can harvest your own tissue and make a sling out of it. And we place it under the urethra so that it sits like a hammock and restores the support to the urethra that you've lost, so that when you cough really hard or you laugh, that urethra stays still and it can't jiggle. Because when it jiggles, it opens and you leak. So that's a surgical procedure which is extremely effective, but it is a surgery. And so there is a recovery period and a little bit of a downtime. And a lot of women find that difficult because, when you're having children, if you're told, no heavy lifting, but you can't go 6 weeks without lifting your 3-year-old or your 4-year-old, that can be a tough decision. And so that's why we're so happy to have other minimally invasive options. And for some women, we do energy-based procedures. So things like Vivive, or using VFit, where you're applying thermal energy in the vagina. And that's helping to restore support by restoring the collagen in the vaginal wall. And so those can be nice options as well. So, I think that when we're suffering from these issues, the first step is definitely to see someone who specializes in these issues, because you want to know what all the options are. And then you want to know, what's effective, what's minimally invasive, what's surgery, what's the recovery like. And then you want to really be able to personalize that decision to your life, what fits your schedule, your time, whatever else is going on. So we do have a lot of options for stress incontinence. And it's one of those things that because my friends are this demographic. And so when I hear my friends talk about it, and I say, well, why haven't you seen a urologist? They're only talking about it to me because they know I'm a urologist. And I'm like, but if you had a rash and you went to your primary care doctor and, he or she said, well, okay, put some hydrocortisone cream on it. And you did that and it didn't go away. You would go see a dermatologist. You wouldn't just sit there with this itchy rash, So I feel like with these issues, we have to encourage women to see specialists who focus, on these problems. So if it's incontinence, you want to see a urologist or a urogynecologist. If it's menopausal issues, you can go to the North American Menopause Society website and see who actually specializes it, because a lot of women assume that, every gynecologist treats menopause, but that's not true. Gynecologists have so much on their plates. They're dealing with menstrual pain, heavy menstrual bleeding, ovarian cysts, all, breast cancer, uterine cancer. They have plenty of stuff. So, not everyone specializes in menopause. And so whatever the issue is, whether it's incontinence, whether it's menopause, if it's prolapse, like pelvic organs that are bulging out, you want to go see the person who is doing that exclusively in their practice. And for stress incontinence, it goes so undertreated. It's so common, and very few women actually seek, medical advice about it. Or if they do see their doctor, it's such an embarrassing topic. And so, I really want to emphasize that we have such nice options, and it's a problem that can get so much better, or be cured completely, if you just see the right person.
That's fabulous. And we actually had questions about that. How do I find the right person? What kind of questions can I ask them? What kind of screening can I do? How do I know who to go to? And I think you got to sort of the first piece of that in terms of pairing the issue with the right type of physician. But how can you kind of screen and make sure this is a good fit?
Yeah, that's really challenging. Because, all types of healthcare providers have all different types of practice setups. And I think, the first step is obviously if you have, a doctor. A lot of women have great relationships with their gynecologists. So if you have a doctor like your gynecologist or your primary care doctor who you trust, they would be the first person that you could say, like, look, this problem has been bothering me and I'd like to see a specialist. And hopefully they can sort of, guide you towards who they would refer to. And that's much easier. Unfortunately, it's much easier in urban areas. When you get out to rural areas, it's actually much harder to find female urologists and urogynecologists. But, certainly the first step would be, I think, to ask if you have, a trusted doctor who they would send to. And then the next step beyond that, I think, is to check on the society websites. So like, for example, for urologists and urogynecologists, you'd be listed as a provider. You can look up providers by region. So you can look up on the International Urogynecology Association website. There's an American Urogynecology Association website, AUGS. The AUA has sort of a female urology organization called SUFU, and they have a find a provider. So most of these like society websites have a find a provider function. And I think once you find that person, if you don't know them, if you weren't like personally referred to them, the next step would be to check out their website. A lot of times, from their website, you can kind of glean what does this person do a lot of. And, people definitely have their niches. Like for me in my practice, I do a lot of incontinence. I do a lot of overactive bladder. I do a lot of genitourinary syndrome of menopause. I don't do a lot of, high grade prolapse repairs. So if someone called my office and, said, does Dr. Kumar do hysterectomies? Sorry, I think we have a visitor. My office would say, no, if you think you need a hysterectomy, then, we actually often will say, oh, if you think you need that, here's who you should call, because we're a boutique office. So we provide a lot of sort of like personalized, we answer our phones and we talk to people. And, even if they're not coming to see me, I tend to try to figure out what I can do to tell them, to guide them in the right direction. So I think you can like glean a lot from that. And, for example, I do a lot of interstitial cystitis and recurrent UTIs, and some urogynecologists focus exclusively more on, prolapse repair, and they don't do a lot of recurrent UTIs. And so sometimes I'll have patients who come and see me and, I'll put them on a whole regimen for UTI prevention. And they'll say, but I was seeing a urogynecologist for like 4 years. How come they never did any of this stuff? They were just giving me antibiotics. And I say, because that just wasn't their area that they were interested in. So I think you do have to dig deep to figure out who is the right person. And then, of course, when you see that person, you develop a relationship. I think especially for menopausal issues, it's so important to develop a relationship. As you said, so many of these issues are interconnected. And I'll give you an example. I had a patient who had very severe overactive bladder symptoms and atrophic vaginitis, and she was like 76. And, we treated her overactive bladder. We did Botox injections in her bladder. She got much better from that. From having seen her and examined her, I had told her, you have atrophic vaginitis, you need estrogen in your vagina. So we started her on estrogen cream. And the last time I saw her in follow-up, I always ask, I'm like always the doctor who's asking everybody about their sex life. And so I said, have you been sexually active? And she said, yes, I have been, thanks to you. And this was the best part of my day. Like, to hear that this woman at 76 is now in a relationship where she can be sexually active and enjoy it, and it's not painful, and she's happy because she's glowing because, she's in love. And, there is no sort of like fear of intimacy. And I'm telling you, it was literally the best part of my day to hear someone say, like, yes, I can be sexually active because we've dealt with my bladder and my vagina. Because so many women are just suffering, in silence from that. So I think it's, it's a balance of kind of, figuring out what someone specializes in, seeing them, the relationship you have with them. And then if they don't, if you feel like they're not really interested specifically in the issues that you have, people get second opinions and see, doctors all the time. There's absolutely no harm in saying, do you think I should get a second opinion? Who else should I see? Because we can be so super specialized as physicians. And we can help you. We can tell you, oh, I know who does a lot of this. So my advice is like, use us, ask us, probe us. If you're not getting what you need, say, do you know someone who maybe focuses a little more in this area? I think that's the way to go. And definitely, do as much research as you can. Most information is like on the internet now. You can pretty much find out anything about anyone. So that's obviously a great place to start.
It's a good reminder to be our own advocates, though, isn't it?
Yeah, definitely. And it's interesting because if you think of so many things, like if your kid had a broken limb or something like that, you'd be searching for a pediatric orthopedist, and you'd be asking all your friends, like, who should we have the surgery done with? So, we have to think of the same for our pelvic health, because it's our sexual function, it's our bladder function, and it's our bowel function. So, it's, even though we can't see our pelvic floor and our pelvic organs, they
critical pieces.
Exactly.
Yeah. So you mentioned prolapse several times, and we had several questions around that. Specifically, sure. we have someone ask, they're 60 years old, they've had mild bladder prolapse for a few years. She says it doesn't really hurt now, but she's worried it could be worsening. So what steps could she take, surgical or otherwise, to correct things before it gets worse?
So it's great to be thinking about this and trying to figure out how to prevent it from getting worse, because definitely there are steps that you can take. The first thing would definitely be to go see a pelvic floor physical therapist, because those muscles around the organs, if you can strengthen those muscles, they will actually lift your organs back into your pelvis and take the strain. When you start having a prolapse, it's almost like having a hernia. So every time you bear down or you're putting weight down on that area, which if it's in your pelvis, every time you're basically standing or, running or moving or coughing or sneezing, you have weight pressing down on that area. You want your pelvic floor to be there to protect your organs, like your bladder and your rectum, from pushing through. So number one, I definitely recommend pelvic floor physical therapy. And then number two, I also think for patients who have a very sort of like a mild prolapse, I do think that the energy-based procedures, like we mentioned Vivive, and using something like the VFit, which you can use at home, is really helpful to build collagen in that vaginal wall, to make the tissue strong. So that you don't have a worsening of the prolapse. Those are for sure the first two measures that I would use. The third thing would be using something like a pessary. If you're going to the gym or you're going to be on your feet all day, or let's say you get bronchitis and you're really coughing a lot, you may want to use an intravaginal device in that period of time, just to keep things propped up and prevent any more sort of separation or weakness in that connective tissue. And then certainly surgical repair can be considered if it does get worse. But I think that there's a lot that you can do to prevent it from getting worse. The other thing I always have to slide in there is that I'm a big fan of Pilates. I think that Pilates, especially if you do it on the reformer, it does an amazing job of keeping your core muscles really strong, and and especially your transversalis, which is like your sort of inner abdominal muscle, that's sort of your corset. And that also, maintaining that core strength, helps to prevent you from putting so much pressure on your pelvic floor. So lots of, I think there are lots of lifestyle things, like for people who, also if you're very overweight, losing weight is a really important measure to prevent both prolapse as well as stress incontinence. If you smoke, smoking degrades your collagen, so you want to quit smoking. So there's a lot of different lifestyle changes as well as interventions that I think can be used to prevent a prolapse from advancing.
Thank you. So we teased a little bit about UTIs. We had a lot of questions about UTIs.
So UTIs
probably no surprise, I'm guessing, for anyone who's ever had one. They're not something you just sit by idly and hope it goes away.
No.
So let me see if I can get to some of these. Of course, you're not going to be surprised, but I'm going to give you two at once because you'll be able to easily take these, I think. The first is it true cranberry juice can help? And the second is, when I was younger, it wasn't something I really dealt with, but now that I'm in my 50s, I keep getting them. They're recurring. Why are they recurring, and how do I prevent them?
Okay, so these are two great questions, and I will apologize in advance if I talk too much. So the first one, so cranberry and UTIs. So the reason why we even talk about cranberry with UTIs is because cranberry has an enzyme which is called PAC. It's proanthocyanidin. And that enzyme actually prevents bacteria from being able to stick to the lining of the urethra and the bladder, which is the first step in the bacteria being able to cause a UTI. Because if bacteria couldn't stick to the urethra, when you pee, it would all just flush out. So when women get UTIs, you have to be colonized. Usually it's a bacteria from the GI tract, which colonizes the skin around the anal area and then the vaginal area. And from there, it's very easy for it to gain access to the urethra if you express certain receptors that it can stick to, and the bacteria expresses certain proteins that can stick to the receptors. So the PAC in cranberry actually interferes with that. Now, the challenge is in finding a cranberry product which actually is high in a high quality PAC, which concentrates well in the urine. And they test this, the companies test something called the PAC, the anti-adhesion activity. So there are some very good cranberry supplements on the market. The problem is there are a lot of supplements, and most supplements are not regulated by the FDA. So when you take a cranberry supplement, anyone can advertise that it has, 36 milligrams of PAC, and you don't know that it actually has that. So there are a couple of brands that I usually recommend with my patients that I've been using for a long time. And possibly there are other ones which are good as well. I just don't know, because you can't trust what's on the label. So that's why we talk about cranberry as a measure of prevention. I do recommend cranberry supplements to patients who have UTIs, certain ones, but a cranberry supplement will not cure. If you have an infection, it will not cure it. But there is definitely science behind cranberry supplements, PAC, and UTI prevention, which I believe in. So, that's sort of why we talk about cranberry. Now, the second question about, I never got UTIs in my 30s and 40s, and now I'm getting them in my 50s. So this has everything to do with estrogen and vaginal estrogen. And so as you start going into perimenopause and then menopause, first your estrogen levels fluctuate and then eventually decline. But the vagina is getting overall less estrogen. And when you have less estrogen in the vagina is no longer protecting you from getting UTIs. Normally, the vagina is acidic. The pH is acidic, and you have a healthy microbiome where you have a healthy bacteria called lactobacillus, which predominates in the vagina. Lactobacillus loves estrogen. Estrogen creates nice, thick, healthy cells which lactobacillus likes to thrive around. When you lose the estrogen, you lose the lactobacillus, and now the vagina is no longer protecting you from getting UTIs. So if someone has that history, the first thing I will recommend is starting to use estrogen cream, like 2 or 3 times a week, to replace that estrogen in the vagina, as well as, you know, something like a cranberry supplement. And then if a lot of women are getting UTIs post-coital, so with sexual activity, and then we usually recommend something called post-coital prophylaxis, where you can take 1 pill of an antibiotic immediately after sexual activity, which is very effective in preventing them. I usually will do that for about 6 months until you've had no UTIs, and then we stop it. And then we talk about, you know, other things to do after sexual activity to prevent the UTIs, but we try to come down on using the antibiotic. So a number of, you know, measures can be taken, but the reason why it starts happening, you know, in your 50s or 60s, it does have to do with menopause and lack of estrogen in the vagina.
And you mentioned cranberry supplements. How about cranberry juice? Just drinking cranberry juice.
So it's interesting, you know, Ocean Spray has actually done, you know, studies on their juice, and I think that they may even have, you know, like a UTI prevention juice coming out. It's equivocal because it depends like how much of it you drink. It depends on the brand, and there have been some studies that show that juice works better than pills, and then there have been other studies that show that pills are better than juice. I typically recommend pills because I think you'd have to drink so much cranberry juice that it would be impractical. And, you know, it's a lot of sugar. And then if you get the kind that's sugar-free, those, they put like, you know, sucralose or artificial sweeteners, which give people a lot of like bloating. So I don't typically recommend juice, but it's hard to say whether there are some juices which do work, but I typically go with the supplements that I think are reliable.
Okay, 2 more. I'm going to combine 2 again. One is there any magic to the type of underwear that we wear? So does cotton underwear help? And then the second one is, do they become more dangerous as we get older? Are there additional things we should be concerned about as we age?
So as far as wearing cotton underwear, I think that, you know, it doesn't decrease the risk of getting urinary tract infections. But I do think that when women have issues with urinary leakage, what they're wearing, whether it's, you know, a panty liner or nothing, or some women even say like, oh, you know, I put paper towels in there, or, you know, I do think that what someone is using and how well it wicks away moisture is important. But I don't know that, you know, I think cotton underwear is comfortable and it's not, you know, it's not, the fabric's not irritating, and it's absorbent if there is like a tiny bit of discharge or leakage. So I like cotton underwear, but I don't think that I don't think that it necessarily decreases the risk of urinary tract infections.
And any worry about them getting more dangerous as we get older?
So I do think that women who get frequent urinary tract infections, what I have seen is that your bladder can sort of enter a state of chronic inflammation. And so what you hear is, you know, I used to get UTIs and I would take antibiotics and I would feel better. And then I would get another one and I would take antibiotics, and within 2 or 3 days I would feel better. And women who get a lot of UTIs, you know, they tend to enter this state where they're like, and now I just sort of always feel like I have one, even though it's like not that severe, but it almost feels like I have a low grade one all the time. And my bladder's much more sensitive. So I do think that can happen as a result of the chronic inflammation, and you get nerves in the bladder which get switched on during a urinary tract infection and then keep the bladder very sensitized. So I do think that you can have changes in the sensitivity of the bladder from having had multiple infections. So it's obviously, preferable to try to prevent them. And then, I think as far as other sort of long-term consequences, women are always really concerned, if I get an infection in my bladder, is it going to spread up to my kidney? That is a concern, but it actually happens in a very small percentage of people. In older women, like, in their 80s, 90s, the dangerous thing about UTIs is that you can have, a lot of those women will have one and they don't feel the bladder symptoms. And so it goes on for a while and they have more vague symptoms like maybe just some abdominal pain, or they're very fatigued. Like their children will notice, oh yeah, she's very tired. She hasn't gotten out of bed the last 2 days. She's not eating. So more sort of like failure to thrive type symptoms. And that's where, you see it progress because it brews for a long time. And so then you can see things like bacteremia and sepsis. But in younger, healthier women, typically, that doesn't happen, and you do get bladder symptoms. So, it's a whole range, I would say.
Okay, I think you checked off all of them under UTIs. Well done. We now have a question just in general about genitourinary health and how your diet specifically affects that.
So interestingly, some women do notice that their bladder symptoms are worse when they eat like spicy food, things that are acidic like tomatoes, having alcohol, caffeine. Some people really notice that those are triggers for bladder symptoms. And, we typically think of that in patients who have something called interstitial cystitis. But I mean, I have patients who, I would not diagnose with interstitial cystitis, who just know that their bladders are very sensitive to certain things. So I think, that's number one. Number two, staying really well hydrated is important. I have patients who have a feeling of like burning with urination, which is worse, or they feel burning in their urethra, which is much worse when they're dehydrated. So you always want the tissue to be nice and well hydrated. I consider using estrogen in the vagina, like the multivitamin for the vagina. We have an expression that there's no vagina in the world that doesn't need estrogen. So I think that that's probably the most important nutrient you can give the vagina. And, again, it's protective against getting urinary tract infections. It helps obviously with dryness and discomfort with intercourse. And so, that actually works much better when you use vaginal estrogen and you just use cream in the vagina. That's local therapy. That's not hormone replacement therapy, which is where you take pills of estrogen or you use a patch and you're actually raising your blood level of estrogen. The symptoms of genitourinary syndrome of menopause are actually more effectively treated by just using the cream in the vagina, which also doesn't carry any of the risks of hormone replacement therapy. It's very safe. So as far as, how we want to nourish our vagina, pelvic floor, and bladder, I would say the best nutrient is estrogen.
Amazing. Okay, we have a question specifically around limiting sexual activity. It says, after age 40, do you need to limit sexual activity for your pelvic floor or vaginal health? For example, is daily too much? Is there anything that would be a driver or an indicator for trouble, or is there any need to limit that?
No, not at all. And in fact, it's so healthy to continue to be sexually active because it actually helps to maintain the blood flow around the vaginal tissue. So it is actually really good for your pelvic floor health to continue to be sexually active. And, as far as things like how often, that just totally depends on, your appetite for it. I mean, some women do feel like if they have a lot of sex, over a short period of time, like they do feel kind of like irritated and they need a little break. And so, but if you don't feel that way and you want to keep doing it, I think it's great. Keep doing it. There is definitely no limitation. I think it's healthy to be sexually active at every age, and actually really good for you.
Another reason, right?
Yeah.
If there was one thing that women could do to be proactive about their urologic health, what's one thing we could do from home to try and maintain health?
So as far as things from home, number one, definitely, use, if you do have dryness, if you're experiencing those symptoms, whether it's after having a baby, like a lot of women don't realize that postpartum women, their estrogen levels drop as soon as they give birth, and then they're breastfeeding and you lose estrogen in the breast milk. So a lot of postpartum women have, dryness and pain with intercourse. And, menopausal women, if you're experiencing those symptoms, the first thing that you can do from home is find a specialist who treats these issues. Don't try to, ask some random person who's not going to give you kind of a comprehensive picture of what's going on. A lot of women, they'll lean on, like somebody whose friend is a pelvic floor physical therapist, or, and so they get one piece of it, but they're not getting the whole picture the way they would if they were being treated by a doctor or a nurse practitioner or somebody who really specializes in these issues. So I think the first thing you can do from home is, find the person you're going to go see who's going to help you with this problem. Other things, definitely, pelvic floor physical therapy. If you've gone to see a pelvic floor physical therapist and you need to maintain it, there are good intravaginal devices that you can use from home that help to maintain pelvic floor health. So I think you want to be doing that, because if you just go see a pelvic floor physical therapist for 6 weeks and then you don't do it, and then you don't do anything after that, it's going to be hard to maintain the progress that you've made. And then I think it's really important that women are open about these issues. When you talk to your friends or your family, if you're dealing with these problems, there is no need to suffer in silence, because most people are. And so chances are, if you mention it, to your aunt or your friend, they're going to say, oh, you know what? I had the same thing. And actually, I went and saw this great pelvic floor physical therapist. Let me give you her name. Or I went and saw this urologist and I didn't really like him that much. So then I found this other person and he was great. You know what I mean? The conversation definitely needs to happen, because we tend to help each other and we give each other advice. And this is an area that we need to be doing that in the way we do it in other aspects of our lives. So I think, share information, find a good specialist, keep doing your pelvic floor physical therapy. If you're using estrogen cream, make sure you're using that topical estrogen. If you're getting UTI symptoms, some women get UTI symptoms and they just ignore them, or they think, they can just drink cranberry juice and it'll go away. And then they progress to a more chronic inflammation. So if you're having UTI symptoms, definitely, see a doctor, get tested. Make sure that you're being proactive about what's going on down there, instead of just kind of like pretending like it's not happening.
Right. We had a great question in the chat. We mentioned briefly pessaries earlier, but she's wondering, is it okay to use tampons as a pessary?
Yes, absolutely. If that works for you, then, definitely you can do that. Companies have made products. There's one made by Poise, which looks exactly like a tampon and is actually meant to be sort of like a bladder support. And a lot of women actually who have had stress incontinence notice that when they use a tampon, their stress incontinence resolves. And that's because having that tampon in the vagina is actually giving some support to the front vaginal wall so that the bladder can't move much. So I think if that works for you, you can absolutely do that. There's actually a story of this was published in the Female Pelvic Medicine Reconstructive Surgery Journal, which is the Journal of the American Urogynecologic Society. It was a story of a woman who was actually using a ping pong ball as a pessary, and when she went to see this urogynecologist, she's explaining to him the problem, and he pulls out this ping pong ball, and she goes, "Oh yeah, I put that in there, and it seems to fix it." And so, and she takes it out herself, and she cleans it, and she puts it back in. And when he offered her, and there was no like evidence of damage to the vaginal wall or like changes from whatever a ping pong ball is made from. And when he asked her, okay, well, here, I can give you an actual like medical grade silicone pessary, she said, "No, thank you. I have something that works, and I'm just going to keep on using as long as, you're telling me like it's not causing any tissue damage or anything like that, I'm going to keep on using my ping pong ball." And that's what she did.
Creativity.
So, yeah. So I think, with a tampon, as long as they're disposable, you take it out, you're changing it. If that's something that works and is a really practical solution for you, then absolutely.
So you mentioned the sling earlier, and obviously I think there's been some bad PR around the mesh sling and cases where it did not work and caused harm to the women who had it. Can you help kind of differentiate between what you're doing now and what was happening then?
Yeah, so that's a great question. It's a subject of great controversy, and I think unfortunately, what happened with slings is that they got lumped together with the mesh that's used for prolapse repairs. So when prolapse repairs were being done through a vaginal approach, these sort of wider sheets of mesh were being used, and they were being placed deep into the pelvis. And so a lot of the complications that you hear about from like vaginal mesh surgery were happening because of the prolapse repairs. The slings actually are known to be, number one, extremely effective, and the complication rate from slings is actually extremely low. It's comparable, when you think about potential complications from surgery and you think about things like, bleeding, infection, extrusion of the mesh, pain from the mesh, that was happening around 3 to 10%. And actually for slings, if a woman has a complication from a sling, you can pretty much remove most of it. If a woman has pain or something like that, you can pretty much get it out. With the mesh for prolapse repairs, you can't. It's really like it's really socked in there, and so it could have devastating effects, because if you had pain from a mesh prolapse repair, there wasn't a whole lot you could do to get it out. And unfortunately, slings just became part of the repertoire of vaginal mesh surgery. And so when the media, is publishing articles, they sort of lumped it all together. And actually, it's kind of unfair to slings, because no one ever actually talked about the hundreds of thousands of women who are dry because they had a sling, who are so happy that they had the sling surgery and it worked really well and they have had no complications. There's this very biased focus on everyone who's had complications, and then it gets lumped in with the pelvic prolapse mesh, and so you're not really looking specifically at the efficacy and the complication rate of only slings when you hear these stories in the media. So, and not that I think a sling it's certainly not the first option. And it's an aggressive option, and you start moving on to those aggressive options when more conservative things have failed. So, we don't usually offer a sling as like the first thing that you do. And that's also why bulking agents are really popular now, because they are so minimally invasive and it doesn't require surgery and it doesn't require mesh. But the slings kind of, they took the baby with the bathwater with the slings, unfortunately, because it is a very effective operation. There are hundreds of thousands of women who've done absolutely fine. And the complication rate is actually not different from, let's say, like a hernia. General surgeons do hernia repairs. The complication rate is actually no different. And so I think that the perception of slings by the public got skewed by what happened with pelvic organ prolapse mesh.
Thank you. You've completed our list with a few minutes to spare. Amazing. Thank you for the information. Any last parting words? Anything else we need to know that we didn't ask?
Well, there's so much we could talk about. But I think, definitely for anyone who's having bladder issues, vaginal issues, please see a urologist or a urogynecologist. Please ask if you're not getting referred to a specialist, please ask that of your doctor, or, ask your friends, ask people in the community that you trust. Go on the society websites. They all have a find a provider, function, and make sure that you're getting good quality and complete information about your issue, so that you can really be managed in the best way possible, because so many women go years with suffering from these problems before they actually seek treatment or before they get treated. So I just really encourage everyone to look for the right doctor or healthcare provider who can help you.
Agreed. And I think you said it earlier, but one of the reasons we do these events is just to make sure that we're all talking about it, right? For whatever sad reason, these very common subjects were just far too taboo. So to just talk about it with anyone, your partner or a friend or, medical professional, anyone, I think it just feels so much better to know you're not alone and there are solutions that exist.
Yeah, absolutely.
We appreciate you sharing your evening with us.
Thank you so
and
much.
All of the education and information. Have a good night, Dr. Kumar. Thank you.
All right. Thank you. Take care.
Bye.